Prayer for frontliners from a grateful nation. Lord Jesus, our Savior, you praised the good centurion for caring for his servant. Wrap our frontliners with your love as they risk their lives for people they do not even know. You healed the hemorrhaging woman by allowing her to touch you. Give our frontliners your peace as they touch so many frightened lives. Jarius, assure our frontliners the joy of returning to their loved ones as they serve you and save our nation. Already our transformation is happening as we witness their selfless dedication. Divine Healer, may their courage to face danger be not in vain. Please bless the work of their hands, that together with them, we may all know that you are God. Prayers are precious to you, as they are to us. Let them rest on your lap when they are tired, and find comfort in your embrace when they are weary. We ask all these and trust in Jesus' mighty name. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, kaya sa silanganan, alam ng puso, sa likid mo'y buhay. Lupang binirang, kuyagan ang magiting, sa mandulupin, di ka pasisigil, sa nagagang tulog sa simoy at sa langit kong bagaw, ay hinagang tulad, awit sa pagkayang minamahal. Kapis lang ang patawad mo'y tagumpay na naghihingi, mapituwin at araw niya kailan pa may makikinig. Luman ang araw ng warhabit pagsika, buhay langit sa piling mo. Ang inigaya na pagkay ng langit, ang mamatay ng dahil sa'yo.
Before we start our webinar, here are some reminders and guidelines for our virtual participants. First, please observe proper webinar and video conferencing etiquette. In addition, please change your settings to speaker view. Also, you may post your questions through the link shown in your screen. Alternatively, you can also post your questions through the chat box in your Zoom console. Lastly, details on how to get your e-certificates will be flashed at the end of this webinar. We expect your adherence to these guidelines. Thank you very much. The BioRisk Association of the Philippines, in collaboration with the Philippine Association of Medical Technologists, warmly welcomes you to our third joint webinar. This webinar will cover the known or anticipated characteristics of SARS-CoV-2 that influence risks of laboratory-acquired infection and/or release of the biological agent from the laboratory. It will also include an extensive discussion of the points to consider for internal or external transfer or transport of SARS-CoV-2, including current International Air Transport Association recommendations for shipping. Let us all welcome our webinar moderator for this session. He is the National President of the Philippine Association of Medical Technologists and Vice President of the BioRisk Association of the Philippines. Ladies and gentlemen, Mr. Ronaldo Puno.
Good evening, good morning, and good afternoon to all our more than 1,100 participants, wherever you may be across the globe. Welcome to the third BRAP and PAMET webinar, and I am Ronnie Puno, and I will be your moderator for today's session. But before we start, I would like to request everybody to please turn off your video and your microphone so that we can hear and understand the speaker very clearly. First, I would like to greet our BRAP and PAMET members and all other participants joining us in this webinar, both in our official online platform, as well as those watching over live streaming. Tonight, we shall be hearing two important, timely, and relevant topics related to COVID-19 with the aim of further enhancing our knowledge and skills as we continue to provide services to those who need it. So in this session, we'll be hearing two important topics, particularly SARS-CoV-2 hazard identification and the current IATA recommendations on transport and shipping. The first topic will talk on hazard identification, being a part of the process used to evaluate if any particular situation, item, or thing that may have potential to cause harm. And the term often used to describe the full process is risk assessment. That is, to identify hazards and risk factors that have the potential to cause harm. The other topic is on current IATA recommendation on transport and shipping. And the International Air Transport Association, or IATA, is the industry's global trade association. It was founded in 1945 with 230 members in 130 countries. And the IATA represents 93% of international scheduled traffic. So may I now introduce to you our esteemed speaker who came from the United States. So our speaker is a principal member of the technical
Sir Ronnie?
Yes.
My opening is Doc Martin.
Okay, so before I introduce our speaker, may I call on our BRAP President, Dr. Martin Moreno, to give us a message.
Good evening to all our participants on this BRAP-PAMET third session of our webinar series, which is a joint activity by the BioRisk Association of the Philippines and the Philippine Medical Association, Philippine Association for Medical Technologists, or PAMET, especially to its National President, Ronnie Puno, former President, Dr. Laila Florento, and to South Luzon Regional Director, Professor Oliver Dumawal. Welcome to our BRAP and PAMET members. Our speaker tonight is one of the country's mentor in biosafety and biosecurity. She will be properly introduced later by Sir Ronnie. I wish to say a few words to my friend, a colleague, a mentor, advisor, and an elder sister, which I never had. Welcome to our activity again, Cecilia. And thank you for the many years you have been with me and Socorro, my wife, and now with BRAP and PAMET. There are quite a few who already know her since she has been lecturing on various topics around the Philippines, especially on IATA transport and shipping. And to those who will listen to her for the first time tonight, brace yourselves for a good, clear, and informative. Again, to everyone with us, welcome to our webinar, and let's all have a great learning session together. Break a leg, everyone.
Thank you very much, Dr. Martin Moreno, our BRAP President. So at this point, I would like to introduce our invited speaker. She is a principal member of the technical staff in the Global Chemical and Biological Security, or GCBS group of Sandia National Laboratories. Over her 38-year career at Sandia, she has worked as a principal investigator on a diverse technical portfolio, including defense initiatives, environmental restoration technology development, strategic petroleum reserve projects, chem biowarfare agent decontamination, technology transfer and commercialization, algae biofuels research and development, and the full-scale global biological threat prioritization effort. It also covers chemical and biorisk management curriculum and trainer development. Currently, Dr. Cecilia leads the group's chemical security initiatives in India, as well as the BioRisk engagement initiatives in India and the Philippines, and conducts analysis to support the U.S. government's chemical biological threat decision making. Also, she actively participates in many of the group's laboratory chemical risk and biorisk management training efforts. Previously, Cecilia was part of the Sandia team that developed and tested Sandia Decon foam that decontaminates both chemical and biological agents. She is also certified in hazardous waste management and has worked on a number of technology demonstrations aimed at transitioning former Eastern Bloc technologies to the United States of America. Dr. Williams recently completed a study on the proliferation of skills and expertise at Chinese bioscience research institutions and biotechnology sectors created by the flow of people and ideas between India and China. Cecilia has Masters of Science degrees in Organic Chemistry and Igneous Geology from the University of New Mexico. Cecilia earned her PhD from Texas A&M University, researching in the interaction of a rotavirus non-structural protein and enterotoxin with the cellular tubulin. Ladies and gentlemen, please help me welcome Dr. Cecilia V. Williams.
Hello, everyone. I'm really honored to be a part of this webinar, and I really want to thank my colleagues at BRAP and PAMET for inviting me to share our current knowledge on SARS-CoV-2 and COVID-19. I'm going to go ahead and share my screen right now. Continue. Let's see. Up to my screen. Oops. Hold on a second. Share. Okay. Can you see my screen?
Cecilia, we can see it.
Okay. I'm going to turn off my video because I don't like to watch myself talking. And so I'm going to go ahead and start the presentation. The first presentation is on the hazard characterization of SARS-CoV-2. Okay. One of the first things I would like to comment on is that it is very important that you do a continuous risk assessment when working with a SARS-CoV-2 and or COVID-19 samples. The information that we are going to provide is to inform individuals and organizations on their risk assessment, and is based upon biosafety and biosecurity decisions. We have attempted to give you the most current information we have at the time, but please note that what we know and what we don't know is rapidly changing. So individuals should do an assessment on a daily basis of what is known and is not known. And they should take the information and use it to work safely and securely in their laboratories. And they should be willing to challenge and change procedures based upon the new information. One thing I would like to caution you of is that you have to carefully evaluate the quality of the information that you are receiving, because there is a lot of misinformation circulating. My next slide gives you the objectives of this module. At the end of this module, we would like to have given you the known or anticipated characteristics of SARS-CoV-2 that influence risks of laboratory acquired infections and or the release of agents from the laboratory. We want you to feel confident that the information that you're receiving is current and relevant and has been reviewed by trusted subject matter experts. We want you to be able to use the information that we give you to inform your local decisions on biorisk management when working with or when encountering SARS-CoV-2 in your laboratories. This next slide is sort of a definition of terms, because there is some confusion out there. SARS-CoV-2, severe acute respiratory syndrome related coronavirus type 2, is the name of the virus that is causing the coronavirus disease 2019 and the current pandemic. It's the virus itself. COVID-19, or coronavirus disease 19, is the disease caused by SARS-CoV-2. Although not technically correct, the terms are often used interchangeably. Remember, SARS-CoV-2 is the virus or the causative agent, and COVID-19 is the disease. So let's talk about SARS-CoV-2. The first step in an effective risk assessment is a hazard characterization. So what are the potential risks posed by SARS-CoV-2? Well, there's exposure or infection of laboratory workers. There's accidental release from your laboratory resulting in exposure of the community, that is humans or potentially animals. And then there's always theft or deliberate misuse or diversion by an actor with malicious intent. So these are the potential risks. In order to consider the likelihood or consequences associated with these risks, the following characteristics of SARS-CoV-2 should be considered and analyzed. We need to know the route of infection, the infectious dose, the ease of causing transmissible infection, that is the population susceptible or immune? The ease of transmission among individuals, is it highly contagious? The time period in which infectious particles are shed from those harboring the virus. What is the stability of the virus in the environment? Is it susceptible to disinfectant? What treatment options are out there, and what is the host range? Many of these things we still do not know the answers, and this information is developing daily. So let's talk about some basics about the virus itself. It belongs to the family of Coronaviridae. The genus is beta coronavirus. Corona, as many of you know, is Latin for crown, and the virus got its name because of its spike-like projections. Excuse me. The virus is a spherical envelope virus encapsulating a positive stranded RNA virus encoding a 30 kilobase genome. It's approximately 125 nanometers squared in size. After entering the cell via an ACE2 receptor on the epithelial cells, you have translation of the RNA that gives rise to 4 structural proteins, which give the virus its distinctive shape, and 16 structural proteins. Let's back up and talk a little bit about this ACE2, a cellular surface protein. It's an enzyme that generates smaller proteins, and the spike protein itself binds to the ACE2, and it's like a key into a lock, and so it makes a doorway for the SARS into the cell. So in January 2020, the coronavirus was identified as the causative agent for the outbreak of viral pneumonia in Wuhan, China. And now the disease is called COVID-19. There are other closely related coronaviruses that also cause respiratory disease. There's the severe acute respiratory syndrome, or SARS, which we saw in the early 2000s. And then there's the Middle Eastern respiratory syndrome, which is MERS. So I've already mentioned some of this about the ACE2 protein. The virus membrane itself fuses to the plasma membrane of the host to gain entry, where it is transcribed and leading to viral replication, translation, and packaging of the new viral particles and release from the cells. So what do we know about the clinical features? The clinical features may include a dry cough, shortness of breath, muscle aches and weakness, fatigue, fever, pneumonia, cardiovascular failure, diarrhea, loss of sense of smell and taste, nausea, vomiting, headache, confusion, inability to wake or stay awake, and partial or complete paralysis. Now, a person doesn't have to have all these clinical symptoms. They may just have some of them. So let's talk about the route of infection. The route of infection is through the respiratory tract. So person-to-person transmission has been shown to occur through direct mucous membrane contact with infectious respiratory droplets produced by coughing or sneezing by infected individuals. Physical distancing will minimize or mitigate this mode of transmission. Also, exposure to contaminated fomites, that is surfaces, high contact surfaces like doorknobs or countertops or bench tops, where droplets that contain the infectious agent may be harbored. So good hand hygiene and a frequent cleaning of these surfaces will mitigate this mode of transmission. Another possible mode of transmission is inhalation of aerosols. This is possible, but not yet confirmed. Because of this, experts are advising that individuals should wear masks when in public, particularly where physical distancing cannot be ensured. For example, if you're in crowded markets or in food shops. Pre-symptomatic transmission has been confirmed through very careful case contact tracing. Additionally, viral RNA and radiographic evidence of lung infection have been identified in asymptomatic individuals who do not go on to develop the disease. Transmission of infectious virus has been described or suspected in limited cases. So there's several modes of transmission. But again, as I have said, some of these modes have not been confirmed. Okay, let's talk about what do we know and what do we not know. We don't know the infectious dose. From information we have about SARS-CoV-1 or MERS-CoV, we know that the infectious dose in animal models is 1 to 100 plaque-forming units. However, precise infectious dose remains unknown for humans. So we suspect that for SARS-CoV-2, the infectious dose is similar. We do know something about the incubation period. That's the period from infectious to symptoms. It currently ranges 1 to 14 days with an average of 4 to 5 days. This is where the idea of a 14-day quarantine arises when you've been exposed. We do know about viral shedding. SARS-CoV-2 can be shed from pre-symptomatic, symptomatic, and post-symptomatic patients. It is suspected in asymptomatic individuals, but it is not yet confirmed. SARS-CoV-2 is a novel virus infecting the human population. It's very susceptible. Immunity is absent in a majority of people who have not yet been effective. Antibodies developed post-infection occur in most people. However, we don't know if this protects from reinfection. I recently read an article that the University of Nottingham has reduced the percentage of the population that needs to have been affected or vaccinated for herd immunity. Initially, we thought it was 63% of the population, but current studies show it's only 40% of the population needs to be immune either by infection or vaccination to essentially stop the spread of the disease. So that's something I read yesterday. So let's talk a little bit about its stability and the viral load. If you take a look on the left-hand side on environmental services, there's information from the New England Journal of Medicine and Lancet. Aerosols may be in the air for up to 3 hours. The virus can survive up to 3 days or even 7 days on plastic or stainless steel, but things like cardboard or copper, it's just a number of hours. Paper, wood, and glass, for paper, a number of hours, but wood and glass, a few days. On the right-hand side, we have the viral load in different laboratory samples. The virus can survive in feces and urine up 1 to 2 days, and diarrhea up to 4 days. In cell culture, I've given the data there. And then the lower list gives the viral load in clinical samples. And so you see it varies depending upon if it's a throat sample or a nasal sample or sputum. And this is current data, but again, all of this is being investigated and may change depending upon new information. So all this information has essentially given us a hazard profile. This is what we need to know about SARS-CoV-2 in order to do a thorough risk assessment of how we should work with samples in the laboratory. We know it causes COVID-19. We know it's an envelope virus somewhere between 50 and 200 nanometers. The primary route of infection is respiratory mucous membrane exposure. It can be stable up to 3 days on plastic or stainless steel. It is effectively inactivated by soap and disinfectants. That means wash your hands, wash your hands, wash your hands, clean your surfaces over and over. Humans right now are highly susceptible, and there is currently no treatment or vaccine. However, there are 2 treatments that are being investigated. There's hydroxychloroquine is being investigated, as well as a remdesivir, an antiviral that was developed for Ebola. And a number of different countries, England, China, the United States, and India are all working on vaccines, and some do show promise. What do we not know and is currently under investigation? Is there asymptomatic transmission? We don't know. What is the role of aerosols or small droplets? We don't know the infective dose. We don't know the length of viral shedding, and we don't know about immunity after infection. So these are all still under investigation. So the last several slides, I have a list of references. And what I would like to do is encourage you to, whenever you are working with the different viruses, to take a look at the current data and reevaluate your risk assessment, update your risk assessment as you continue to use a certain procedure. If you're changing your procedure or doing a new procedure, you have to do a new risk assessment. A risk assessment for one procedure will not be adequate for doing a different procedure. So this is the end of the hazard characterization. I'm going to stop a minute and take a sip of a liquid, actually coffee, because it's early morning here. And I will move on to my next presentation, which is a presentation on shipping and transport of SARS-CoV-2 and COVID-19 samples. Let me start the presentation. This information that I will be giving you on this slide is based upon IATA, or the International Air Transport Association guidelines. It's probably true that many of you probably do not ship samples via the airlines. However, if you follow the IATA guidelines in shipping your samples, you can be assured that you are shipping the safest way possible. Now here again, I have my slide on continuous risk assessment. Let me emphasize, you should do a risk assessment of your shipping process also. And recall that what we know and what we don't know is changing. And so you need to periodically review your risk assessment. I want to read this disclaimer slide so that there is absolutely no confusion. Individuals who will be shipping suspected or confirmed SARS-CoV-2 specimens, especially via airlines, must have completed a shipping of infectious substances and biological specimens training and have passed the required examination. If an individual is shipping a culture of SARS-CoV-2, they also must have formal certification. This module is designed as a tutorial and a review for individuals who have completed the IATA-based shipping course and passed the examination. Let me emphasize, this module in no way substitutes for the required training. You must have the required training to do the shipping of SARS-CoV-2 and COVID samples. This slide covers the objectives of the modules. We would like you to know the points to consider for internal or external transport and shipping of SARS-CoV-2 samples. That's cultures or patient specimens. And we also include current IATA recommendations. We want you to feel confident that the information I'm giving you is current, relevant, and has been reviewed by trusted SMEs. We want you to be able to use this information to evaluate your current risk assessment and your biorisk management plan when working with or encountering SARS-CoV-2. Now I'm going to skip this slide because we just covered this in the previous. It's just the known characteristics and characteristics under investigation of SARS-CoV-2. Just to emphasize, what we know about the hazard characterization is still evolving, and you should check periodically on for new information. So one of the first things I want to cover is terminology. I do not want there to be any confusion about terminology. In the context of shipping infectious substances and biological specimens, the movement of biological material outside of a restricted area is transport. Both research laboratories and public health laboratories move or transport and ship biological materials for different reasons. Research laboratories transport or ship biological samples for study and research. Public health and diagnostic laboratories transfer and ship samples for required diagnosis and analysis. Transport can occur within a facility, within a city, a country, or across international borders. So transport is the movement inside or outside restricted areas. The next three terms are really critical. They're packaging, package, and packing. Packaging includes the components or the parts that ensure the integrity of your package. Packing is the action of assembling a package, assembling the packing components to create your package. A package is the completely assembled product capable of meeting UN required testing. Your package includes your primaries, your secondaries, your outer packaging, all components necessary to ensure the integrity and the safety of your shipment. Finally, shipping. There is a process in shipping. Shipping includes classification and identification of your biological specimen. It includes selecting the proper packaging and packing the biological specimen. It includes marking and labeling the package, completing necessary documentation, and making arrangements. Making arrangements is a final step and is an important step in shipping, because you have to make sure that the service that you use to transport, as well as the place where you're sending it, knows that the sample is coming and can let you know that it has been received. Okay, the next slide is a slide on the International Air Transport Association guidelines. This is transport of specimens of COVID-19, of coronavirus, SARS-CoV-2, and COVID-19. On March 7, 2020, IATA issued the guidance for the transport of specimens of SARS-CoV-2 based upon experience of ship Health Organization and national authorities such as the US CDC are advising health authorities to ship specimens of SARS-CoV-2 as UN 3373 biological substance category 3 and follow packing instruction 650. Martin, this is Cecilia. Can you guys still hear me? I got a note that my internet was unstable.
Yeah, we can still hear you, Cecilia.
Okay, thank you. An update came out on 16th April 2020, and this was issued as guidance for transport of cultures of SARS-CoV-2. And so after some investigation and some studies, it was decided that cultures of SARS-CoV-2 should be shipped as Category A UN 2814 infectious substances affecting humans, and should be packed according to packing instruction 650, and a shipper's declaration is required. So to review, the IATA guidance says to pack and ship suspected and confirmed SARS-CoV-2 patient specimens or isolates as UN 3373 biological substance Category B, and should be packed, and when you pack and ship cultures of SARS-CoV-2, it must be shipped as UN 2814, infectious substances affecting humans. This applies to transport and shipments of patient specimens, cultures, or isolates within a facility, a city, a country, or international borders. And again, let me emphasize, personnel must be trained to pack and ship according to the regulations in a manner that corresponds to their function-specific responsibilities. So, cultures go as infectious substances affecting human, Category A, UN 2814. So we're going to talk about now the steps of shipping. The first step is classification. This is based upon the composition and the level of risk posed to human or animal health. So classification can be Category A, B, or exempt. In the case of SARS-CoV-2 or COVID-19 is Category A, Category B. The second step is identification. And here we look at the list of dangerous goods and we assign a proper shipping name. We already know for SARS-CoV-2 and COVID-19, we are going to use UN 3373 or UN 2814. The next step is selecting the proper packaging. And this is based upon the classification. We'll talk about that in the next few slides. Then we have to pack it following the appropriate instructions. Then we have to mark and label. This provides nature of the contents. Then we have to provide documentation and we have to make arrangements. Let me emphasize the package or the actual packaging is an engineering control. It's an engineer to keep your specimen safe and contained. Marking and labeling and documentation, making arrangements are administrative controls. So we're going to review again the classification. Infectious agents or infectious substances are classified by IATA and WHO as Class 6, and specifically infectious substances Division 6.2. So cultures of SARS-CoV-2 are Category A. Category A are infectious substances when transmitted in a form that if exposure occurs, is capable of causing permanent disability, life-threatening, or fatal disease in otherwise healthy humans or animals. We identify it and select a proper shipping name. The proper shipping name is UN 2814, infectious substances affecting humans. That's cultures. To emphasize, Specimens go as category B. Category B are infectious substances that contain biological substance capable of causing an infection, but don't meet the criteria for category A. The proper shipping name for category B is UN 3373, biological substance category B. So in shipping, we have two possible ways to ship our SARS-CoV-2 samples. If it's a culture, it's category A, UN 3373. I'm sorry, UN 2814. If it's a specimen, a patient specimen, it's category B, UN 3373, biological substance category B. So now let's actually talk about packaging. This slide shows us the principle of packing. And whenever you ship any type of biological sample or infectious agent, it must be triple packaged. That includes category A, category B, or exempt. It must include a primary receptacle that's watertight, leak-proof, and this contains the specimen. And here is our primary right here. We can have multiple fragile primaries within here, but they have to be individually wrapped. And we have to put absorbent material around each one. Here we have our secondary. It's a durable, watertight, leak-proof package to include and protect your primaries. And absorbent material shall be enclosed between the primary and secondary, and there should be sufficient absorbent material to absorb all fluid in case of breakage. The secondary then is placed in a rigid outer package. The outer package protects the content from physical damage, and at least, hold on a sec, oops, I need to go back. Sorry. For category B and exempt, at least one external surface must have a minimum dimension of 10 by 10 centimeters. For category A, all surfaces must be 10 by 10. Now we're going to talk specifically about category A packaging. And when you package a category A substance, it must follow packing instruction 620. This is an example of a category A package. All the packaging must be of good quality. The primaries contain your infectious substance. It must be leak-proof if it's liquid, or sift-proof, meaning impermeable to dry contents if it's solid, and they must seal tightly. All primaries are limited to 50 ml or 50 grams if it's going on a passenger aircraft. It's limited to 1 liter or 1 kilogram if it's going on a cargo aircraft. If primaries contain liquids, then you again have to have sufficient absorptive material between the primary and the secondary to absorb all fluid in case of breakage. Multiple primaries must be packaged individually. Your primary then is placed into your secondary. So here's your primary with your infectious substance. Here's your absorbent material, and it's going into your secondary, and the secondary must be watertight. On the secondary, you must place a list of the contents. And again, both the primary and secondary must be pressure capable. And again, your list of your contents, an itemized list of your contents must be placed on your secondary. And this goes into your outer packaging. And all dimensions must be at least 4 by 4 by 4. Oops, I'm sorry, I changed pages accidentally. Sorry, I was playing with my mouse. Here on your rigid outer packaging, you have your UN specification. When packaging a category A agent, it has to be packaged in a UN specified packaging. That on the right-hand side, we have a cross-section of our package. And here we have our primary, our absorbent, our secondary, and then our outer packaging. On the outer packaging, we'll talk about this in a minute, but you have to put the name and telephone number of your responsible party. When we ship a category package, we must follow 50. And again, you have to have a primary. Again, all the material must be of good quality. Your primaries will contain your infectious material, and again, must be leak-proof or sift-proof. Primaries are limited to 1 liter or 1 kilogram for passenger or cargo aircraft. And the primaries must, if the primaries contain liquid, you must have sufficient absorbent in case of breakage. And again, multiple primaries must be wrapped individually. The primary is placed into the secondary, which is leak-proof or sift-proof. If you notice here, our secondary is the plastic bag or plastic container. And so your secondary can be of any type of material, but it has to be leak-proof and sift-proof and pressure capable. The secondary is then placed in the outer packaging, the rigid outer packaging, and 2 sides have to be at least 10 centimeters or 4 inches in dimension. The outer package cannot contain more than 4 liters or 4 kilograms, and any primary cannot contain more than 1 liter or 1 kilogram. Notice that there is no UN specification marking on category B. So it doesn't go through the same testing protocol as category A. However, it must be capable of being dropped from 1.2 meters. This is to verify that the package is designed and has appropriate strength and quality. And again, you have to put the name and telephone number of the responsible party either on the package or on the airway bill. And again, here is our cross section showing our primary, our secondary, which is a plastic bag, and showing the absorbent material and our outer rigid packaging. So you either follow packing instructions 620 if you're packaging cultures or category A. You follow packaging instructions 650 if you're packaging category B or patient specimens. This slide shows how you mark the package of a category A specimen. So marking and labeling is very important, and it's an administrative control. Recall the package itself is an engineered control. Marking and labeling is an administrative control. You have to have the address of the shipper and the consignee. And you have to have the appropriate hazard label. For category A, you have to have the infectious substance label, and you have to include the proper shipping name, which is infectious substance affecting humans, UN 2814. You have to have the responsible party, and you have to include, you have to make sure it's in a package with the UN specification. That's category A, marking and labeling. Marking and labeling category A is similar. You have to have the address of the consignee and the shipper. You have to have the phone number and the name and phone number of responsible party. Sorry, my alarm went off. You have to have the appropriate dangerous goods label. And for UN 3373, we use this, I'm sorry, you have to, this is called a mark. You have to use the appropriate hazard mark for category B, and you have to have the proper shipping name, UN 3373. Note that there is not a UN specification number on this package. I'm going to go back up here. I'm going back here. This package has the UN specification, which is required for category A. This is the hazard label for category A. IATA is kind of funny. This label here, this symbol here looks like a label, but IATA calls it a mark. So please don't be confused. And again, for category B, you do not have the UN specification. So required documentation, again, required documentation is an engineering control. If you're shipping category A dangerous goods, a shipper's declaration is required. It's not required for category B. You have to have a waybill. You have to have an invoice. The invoice should have the shipper's name, the consignee, the number of packages, the contents, weight, and value. And you have to have an itemized list of contents, which is enclosed between the secondary and the outer packaging. Here is just a list of an itemized list that would be placed between your secondary and your outer packaging. So this is just different. This is category B. This is just different COVID, SARS-CoV samples. And we're going to talk about now the shipper's declaration, which is required for category A. So for shipper's declaration, there are 3 copies that are required. This is the top half. On the top half, you have to have the shipper, the consignee, you have to have the number of pages. You have to X out one, either passenger or cargo only. Here I've X'd out cargo only. This indicates that this package can go on passenger aircraft or cargo aircraft. You also have to X out either radioactive or non-radioactive. I've X'd out radioactive because my sample is non-radioactive. Here, the airport of departure and arrival and the airway bill number can be left blank. The indicate the aircraft and indicate active or non-radioactive. Then we have the bottom half. The bottom half in the first column, we have to put the UN ID number. Here we have UN 2814. In the next column, we have to put the proper shipping name, which is infectious substances affecting humans, and we have to put the technical name. In this case, the technical name is SARS-CoV-2. We can skip the division or class. Then we come over here. The packing group is 6.2. And then the next column, we have to have three things. We have to have the quantity of our agent. We have to have the number of boxes and the type. And so we have 25 mils, all packed in one fiberboard box. Then in this column, we have to put our packing instruction. Oops, sorry. In this box, we have to include a 24-hour emergency contact number. Most countries require this. I always include it. And in this final box, you have to put the name of the signatory, the date, and the signature. So some other requirements for category A, the individual must have completed the training, they must have passed a required exam, and they must have formal certification. So if you're going to sign this, you must meet those requirements. It must be in English, and it must be accurate, legible, neat, no spelling errors, no abbreviations, and no whiteout. If you do make a mistake, you can draw a line through it and you can initial it. However, many companies such as FedEx are requiring that you computer generate your shipper's declaration. So you remember to check with your shipping company as to what their requirements are. This is an example of a waybill for biological substance category B, UN 3373, SARS-CoV-2. And we all know how to fill out a FedEx or a waybill. The important things that you must remember is in this line, you must include biological substance category B, UN 3373. You also must indicate whether or not, you must indicate whether or not a shipper's declaration is required. And if you look in this box here, it'll show, this is it shows is not to check. Sorry, my mouse is really jumping around on its own. If either you have to physically write shipper's declaration not required, you must read the specific words are dangerous goods, shipper's declaration are not required, or you must check the box if there is a box on your airway bill. So here in number 6, you see that we have checked the box. So in making arrangements, you have to make sure that you have authorization to ship. And again, who in your facility can authorize shipment? You have to make sure you have a material transfer agreement. That is, the person to whom you're sending it has agreed to receive it. You should consider any export or import requirements. Are there any state or operator variations? You must consider your training requirements and your security considerations. You also must be careful in selecting your carrier. And you should have a shipping program management set up in your facility. And it should have a plan in place on how to handle, package, and transport and ship samples. So this covers all the steps of shipping, which includes your classification, your identification, your selection of your packaging, the actual packaging, the marking and labeling, the filling out of documentation, and making arrangements. Again, I'm coming back to this slide to emphasize that IATA has indicated that patient specimens or isolates should be shipped as UN 3373 biological substance category B, and they must be shipped according to packing instruction 650. And in April, IATA has indicated that cultures of SARS-CoV-2 must be packed in UN specifications packaging according to packing instruction 620 and shipped as category A, and a shipper's declaration is required. The next several slides are a list of references that you can use to verify or look up any of this information. I'm going to stop sharing now, and I'm going to unmute, start my video. At this point, are there any questions? Can you still hear me?
Yes, yes, Dr. Cecilia. Yeah, thank you
Hello?
very much. Yeah, so thank you very much for those two very interesting, relevant, and timely
Martin, are you
topics.
there?
Dr. Cecilia, can you hear me?
Hello?
Yeah, okay. So yeah, I would like to first thank you for sharing those two very important, very relevant, and very timely topics. So at this point, I'm inviting our participants to ask your questions so that our speaker can answer them. Okay, so all right. So let
Martin,
me.
can you still hear me? Question mark.
Yes, Dr. Cecilia, I can hear you. Sir, Sir Ronnie is the, will start the moderatorship of the question and answer section.
Can you hear me?
Go ahead, Sir Ronnie.
Can you hear me, Dr. Cecilia? Doctor. Dr. Cecilia. Wait. I think she's having a problem with her connection. Dr. Cecilia? She can't hear us. Dr. Cecilia, can you hear us? I think she's having some problems with her internet connection. Dr. Cecilia. is still with us.
Dr. Martin, is it possible to call again Cecilia?
Yeah. Yeah, so while
I
waiting
do
for...
not hear you at all, and I'm unmuted.
Okay. Can you hear us now?
Sir Ronnie, she is answering on text message. I do not hear you at all and I'm unmuted.
Oh, so can't hear us? She's... So what should we do? She can't hear us right now. Dr. Cecilia. Is she replying, Dr. Morena? She's
Yes,
sending messages.
she's replying on WhatsApp.
I have no audio from you either.
Oh,
Oh,
she says no audio from us. Sir Oliver, is she on mute?
No, sir. On my end, she's not muted. Cecilia, can you hear us? In our console, she is not muted and still a co-host.
Again, I have no audio from you either.
Maybe we can send the question through chat. Is that possible?
yeah. Or maybe can she read some of the questions posted at the chat box?
I will
think,
ask her.
yeah, so maybe we can ask. And we have
Yeah.
also here Dr. Laila, who can maybe provide answers to some of the questions.
Yeah. Let's try to... I think she's connecting. She's still connecting, trying to connect. Okay, so yeah, we're still waiting for her to connect. We apologize for some technical difficulties.
No, I cannot read the questions in the chat box. It's too small, period.
Oh,
And I keep getting a message that my connection is unstable.
We're hearing Cecilia right now, which means she's still connected.
Shall I try to leave and come back in? Question.
We can hear you,
Shall
Cecilia.
I try to leave and come back in? Question mark.
Martin, because on my end, I can hear her audio.
Yeah, yes, I'm telling her that.
So maybe at any rate, we can still access her audio. We can still hear her audio.
But she says I cannot.
Okay, you can
read
hear me,
questions in
but
the
I
chat
can't
box.
hear you.
So she can't hear us.
Is she connected to Viber or WhatsApp?
WhatsApp.
So maybe we can text the question and then she can discuss the answers because we can hear her audio.
Yeah.
Question.
Yeah. Doc, can I just read the question for you to relay to her?
Okay, Ariel is typing on my.
Yeah. So you can read it at the chat box. The first is what?
Select the first question, Sir Ronnie.
Yeah. So the first question is what is the optimal temperature in transporting both the culture and the specimen?
What is the optimal temperature in transporting both
Culture and
specimen? Temperature and specimen. Specimen. Optimal temperature for transporting culture and specimen. Hindi ko hanap dito.
So I'm able to read some of the chat box.
Okay.
One of it says, what is your recommendation for shipping of SARS-CoV-2 samples? I would ship my patient samples and my culture samples the way I would generally ship any other patient samples. If you ship them with a gel pack to keep them cool, that should be the way you ship. I would not ship them on dry ice. There's a question here that says, what will be the next step if there was leakage of a specimen inside the receptacle upon receipt of package? First of all, you should have a shipping and receiving risk management plan in place. You should have a process of how and where you open samples, especially if you suspect that there has been leakage. I would wear appropriate PPE, that is appropriate respiratory protection, appropriate gloves, and other PPE to protect yourself. I would also open the specimen in a biosafety cabinet, a certified biosafety cabinet. I would have, in my biosafety cabinet, I would have absorbent material as well as decontaminating agents. For SARS-CoV-2, since an envelope virus, 70% alcohol will decontaminate it. Kathy, I'm on my conference call. Okay, bye. Okay, there's a question here that says, can I use a huge styro box with ice in it transporting COVID blood samples? I would say, yes, you can, provided that your blood samples are in a primary, a leak-proof primary. They are individually wrapped and in a secondary. And then you can put your secondary in your styrofoam container containing ice. I have a question here. What are the required number of samples for shipment? There is no required number of samples for shipment. However, if you're shipping patient samples in any one package, you can ship up to 4 liters with no individual primary being greater than 1 liter. So a patient sample is going to be very small. And so you could have as many patient samples in your shipment that would come up to a maximum of 1 liter or 4 liters. So Martin, this is Cecilia. I would like to request that you send me a copy of all the questions we are getting, as I am going to have to leave the webinar now, as I have another webinar starting in 3 minutes. Is that possible?
Yeah.
Yeah, we can definitely do that.
Yes, Dr. Cecilia, we will do that as what we have been doing for webinars, the first 2 webinars we had already. I hope she heard me. Sige, Sir Ronnie, you may.
Okay, so thank you very much, Dr. Cecilia. We apologize for some inconveniences due to some technical difficulties. But at any rate, it was indeed a very informative session that we just had. And I'm just proud to mention that I'm actually one of the...
I want to thank everybody for attending. I'm sorry for my early departure.
You're welcome. Thank you very much also, Doctor. Yeah, so if I may continue with the synthesis, yeah, first of all, we would like to thank our speaker for sharing with us her expertise on those 2 topics. And again, I'm just very proud to say that I'm actually one of the students of Dr. Cecilia when the first ever IATA training was organized here in the Philippines by BRAP-PAMET. So Dr. Cecilia extensively talked about the topics on hazard identification and the IATA recommendation on transport and shipping. So during the first session, our participants learned the known or anticipated characteristics of SARS-CoV-2 that influence risk of laboratory-acquired infection and the release of agent from laboratory. And our speaker also discussed the points to consider for internal or external transport and shipping of SARS-CoV-2 samples, including current IATA recommendations for shipping. It is expected that our participants will be able to use the information provided to inform the local decision makers on biorisk management when working with or encountering SARS-CoV-2 in the laboratory. And before we end today's webinar, we would like to extend our gratitude to BRAP, headed by the President, Dr. Martin Moreno, to PAMET officers, Dr. Laila Florento, and our chair of the Committee on E-Learning, Assistant Professor Oliver Dumawal, and of course, our big thanks to Dr. Cecilia Williams. We would like to thank, of course, all our participants and who joined us, and most of all, of course, to the God Almighty for giving us this opportunity to learn more so we can serve better through efficient and effective performance of our task. So let us all pray that this pandemic be over really soon so that we can make this world a better place to live in. Together, we can beat COVID-19. And with that, I would like to thank you once again. This is your moderator, Ronnie Puno, signing off. So enjoy your hostess.